Okay, welcome to another live recording of the Nursing Home Podcast, the only podcast that you need to listen to learn everything that you need to know about this space, about this fascinating, confusing. Many people are, I guess, misinformed about this space, and especially now with COVID-19 coronavirus hitting the nursing home space so hard. There's so much information, so much misinformation, and this actually affects not just the nursing home population, but their family members, the service providers, and anyone else who integrates with the nursing home space as well. And visitation has been a challenge always, how to manage visitors. And we could talk stories about that another time, about visitors who abuse their privilege. But right now, we've realized the importance of visitation in a nursing home space and how do we deal with it when visitors are not allowed in. But today we're going to focus more on, as we do allow them in, how can we allow them in a safe way that they will be able to maximize their time together with their loved ones without raising any risks to themselves, to the residents, and also satisfying all the new, complying with all the new regulations. So today I'm really pumped. We have with us today, Charles Mann is the co-founder of Accushield, a digital sign-in kiosk technology company, as well as the owner of an assisted living facility and several hospice facilities. And I apologize, I don't have that listed right here. But Charles, for you guys who are listening, and you know me already, Charles is a guy who gets it. He's not just an outsider who's trying to, provide products or services. He's someone who actually was in the trenches, is in the trenches. And I really love having these types of people on the show because they get our world. So, guys, you're going to appreciate what we're going to discuss today. And Josh, thank you for joining us as well. Josh Harris is the director of sales for Accushield and kind of pulled this thing together. So thank you for pulling that out. So, Charles, before we jump in here too deeply, I love for our listeners and the viewers who are watching us now live on LinkedIn, if they can learn a little bit about who's Charles, how did he come to do what he's doing right now, before we learn about what he knows about the nursing home space. So Charles, tell us who you are professionally.
Sure. I think it starts for me when I was about 10 years old, and my father had this idea that he wanted to provide care for seniors. And at that point in time, really the only care for seniors was in a skilled nursing setting on the long-term care side. And he put together a group of individuals and created the first assisted living, which was called personal care, in the late 80s in Atlanta, Georgia. So that was dinner table discussion. And as things progressed, he continued to build and operate communities. He also was involved in home health and hospice, which are sort of ancillary skilled sectors of the market. And really brought me to have a passion for seniors. And about 10 years ago, I wanted to get into the senior housing market, more on the higher level of care, more on the higher acuity sort of care, so memory care, but really an area of the sector that I think was missing, which is sort of the distance between an assisted living and a skilled nursing facility. So went to work with my father about 10 years ago and spent about a year with rolling up my sleeves and understanding true operations in that environment. And then moving forward, I saw a need, and that was a need to address the people that were coming and going, whether that is a visitor, a family member, a home health provider, a vendor, or an employee, right? Because really there wasn't a good method. And so I talked with my father, and he felt that I should spread my wings and become a real entrepreneur. And it was incredibly scary. But the good news is that I had the background that I learned from my father. And he was an expert in all things senior. And so that brings me here today in a place that we're really addressing the health security of facilities. And it's a tough place right now. And seniors and families, and that isolation component without being able to see families and friends is really affecting the industry in a negative way. And so I've been excited to be a part of a lot of different initiatives to whether it be through a mobile Skype solution or other types of FaceTime with residents, but it still doesn't it doesn't quench the need of physical interaction. And so that's where we are today, right? And that's kind of where we've landed as a business, is trying to help facilities and communities with creating those processes to allow visitors and vendors and third parties back into a facility and community environment. So,
wow. So first of all, Charles, first of all, thank you for that full background. So we have a good idea of who you are. Secondly, I love your dad.
Yeah.
I never met him, but I have no idea who he is. But he didn't give you the silver spoon and didn't say, well, my dad has places, you're going to be the CEO of the company. Yeah, you could be, you still don't know how to write an email, and you've never attended any meetings, and you don't really know what seniors are. And unfortunately, that is prevalent. And sometimes, a boost is sometimes, there are kids who can step up to it and make it happen. But the people who actually are forced to learn the business like you did and to work their way up and to find a place, find the right opportunity where you've like you so articulately explained, you expressed that you found the need. There is something here. There's the forgotten component of the senior care space, which is true many times for sure in a nursing home setting. We're so busy providing the care for the residents. We're so busy making sure we have adequate staffing and supplies and ensuring the, so to speak, high level key functions of the nursing home are going smoothly, that someone's coming in, someone's going out. Yeah, we have someone at reception who's usually not on their phone or playing solitaire or out on break again.
Right.
And, the activities person who's taking them over might know where the phone is and things like that. So it's a mismanaged process. And really, besides for visitation, there's security challenges also. I found people in my building who shouldn't have been in there, and we had to invite them to leave. And, that could be a real challenge. So before we go too deep into this, Josh, if you don't mind just sharing with us how you came to be a part of Accushield, and, how are you enjoying your role in the company right now?
Yeah, I appreciate it. So I joined Accushield about 1.5 years ago. Was working for them out in Austin and actually moved to the headquarters in Atlanta about 1 year ago.
I was going to say, you don't sound like Atlanta.
I'm from Alabama, actually. That's not a Texas accent, but
well, it's not New York.
It's not. My mom's from Rochester, though, so it's in there somewhere.
All right, fair enough.
So what my role has been is really just a customer facing out role, speaking to those customers each day in the different communities. And what really I've learned from Accushield and speaking with all these different communities is that everybody has something different. There's either different state regulations or there's different regulations that each community has and different ways they want to go about it. So there's different challenges and there's different successes as well. So speaking with 50 to 60 different communities a week now, really getting to learn the industry and how much goes into it, how much goes into knowing who's in your community, how important it is. Why is it important to know who's in your community? That's really what drove me to this company. To work for Accushield was not only being able to work for a good technology, but being able to do something that matters. In sales, you don't always get to do that. But coming to a company where you can legitimately help out an industry really helps, and being confident in a product that can help is what you look for as a salesperson. And it's rare to be able to help each day, not just the company, but an entire industry. So that's really what drove me to come here about 1 year ago. From a safety and security standpoint, before COVID hit, still knowing who's in your building is very, very important. You really need to track who's coming and going. And there was not a way that communities are doing it outside of a paper sign-in book. So that's really what drove me to move to Austin, a little bit closer to home, see the family, be able to go to the lake more, but also get to work for a company that's making a big difference in the industry, not only the industry, but in the entire country. So that's what drove me to be here.
All right. Well, excellent. is, Charles, it's good to hear someone believing in your product like that. This is someone who did not grow up as part of your family, did not grow up with the same background as you, but has recognized the need that your product is filling. I mean, this is really, it's really fantastic to have him on board. But let's go back to, visitation in general in the nursing home space. We know how critical it is. The first stage, if you will, of the impact of COVID, before even talking about the health, just from the lockdown, was that residents were completely shut off from the world. And for many residents, as we know, sometimes their family members came every day. Right, we had a certain daughter came every day, every morning with Dunkin' Donuts. All the things that the facility didn't let her have, she would sneak in for years and years. Right, all the diabetics getting all the sugar and whatever they need, and when that stops, okay, here's the pet peeve. Residents are people. Residents are us several years on. And it bothers me when I see people making a disconnect. It's like the whole world and then those nursing home people. Those nursing home people are, when you look out the window today, those are the same people.
Yeah.
So imagine if we were sitting, do it. Go to a nursing home, sit in the middle bed of a 3-bedroom, if they still exist, which they do, on the 4th floor, in the back corner room, by yourself with a small TV that people keep on walking back and forth, blocking it. You cannot get out of bed. Your only distraction was looking forward to and reminiscing about your loved one's visit. Sometimes it could be a week. Sometimes I've heard residents, talking about someone's going to come in 6 months. I'm like, I have no idea what I'm eating for lunch. You're talking about 6 months from now?
Yeah.
But yeah, when you're in that type of setting, the social isolation can be so critical. So that was the first step. The first step was what you mentioned earlier. Was figuring out Skype, FaceTime, WhatsApp video, whatever you can figure out. There's so many different solutions, and you need someone within the facility coordinating all of that, and that's not simple. But now in many states or in many locations, they're starting to open up first outdoor visitation. So first of all, educate us. What are the regulations in certain states? What are the phases of visitation, and at what point are people actually allowed back into the buildings?
Yeah, so it's all over the board, and we wouldn't have enough time for me to go through all 50 states and go over the difference in regulations.
Yeah, please don't.
But
just a high level.
Yeah, but being from New York, that's sort of what's in the news right now. And
sure,
New York is starting that phase 3 visitation process, and there's a lot that's going into that. And I was looking at a article, and just to start here, and then talk through why it's taken so long for really the visitation allowance in a skilled nursing environment is what they're saying is 42% of U.S. deaths from COVID-19 are coming from assisted living or skilled nursing. And so that's why it is very difficult to open up the doors, and you have to do it in the proper way. And so right now, in many parts of the country, including New York, they are starting to allow visitation primarily outdoors, if possible, to help with the distance piece. But there's a lot that is mandated, and a lot that has really come to being part of this new normal. Right. And really the issue is, one, making sure that people don't have symptoms, obviously wearing the proper gear, making sure that the distance piece is in the 6 to 10 feet of distance between the patient or the resident and the people that are coming in, to really limit as well the number of people that are allowed to be in the facility visiting a resident or patient. So right now, for the most part, and this is to include New York, they're limiting 2 people at a time, which, I thought that I was thinking it would be more like 1, but 2.
You're talking about, just to clarify, 2 people per resident.
Per resident at a time. Correct.
Got it.
And they're also setting limits on just number of people overall in a facility. And so, there's a lot that is being, we're sort of flying this plane as we build it, right, with regulation. And that's not easy to do. But, at some point, we've got to put our stake in the ground and say, you know what, we're going to open up these buildings and we're going to do it as safely as possible. And the thing that's interesting, I think, that's come out of this, I think, focus on visitors is these are some things that we as an industry have probably always wanted to do with our visitors, because flu, as you know, is a big issue in senior living as well as skilled nursing. And there's other viruses, there's other illnesses that actually can probably be addressed before a visitor walks into a community or a facility environment. And this is giving operators an opportunity with, and I'll just call it that way, I guess, the help of this virus to really screen the people that are coming and going. Because as you know, when I have a resident that goes out and they've got some comorbidities and they're older of age, is this scary? It's scary. And that was probably brought in from someone on the outside.
So you mean those signs that they put on the front door that say, do you have any symptoms? That doesn't prevent people from actually coming in anyway?
Probably not. We certainly do have some rule followers out there. I feel like I'm one of them. But I think that wearing a mask is good, right? And wearing a mask around, especially those individuals, that is a good thing. And you know what? There's times where it might not help, but that one time it does, then it makes it all worth it. And so to me, I look at this being in the industry for 30 years with a father and a developer and an operator. Communities and facilities probably were going to be safer moving forward than they ever have been. And so that is the silver lining with this whole situation, is finally some enforced controls are able to be put in place to maybe do more than they ever have. And so I am going to go on record. I think moving forward in 2021, 2022, facilities and communities are probably going to be safer places. So
you see over here from Robin Weissman is telling us that those signs really never stop people from coming in, which we know is true. Because people say, oh wait, there's a sign, we're not doing it. Some people, like you're saying, maybe you won't. It might get someone to think twice, but if no one at reception is asking any questions, people are going to come through. And I wonder if there's any data available. This probably isn't, because it wasn't being measured as to the source to, and when a nursing home gets any outbreak, a flu outbreak or anything, it's very serious. And many times residents are going to die, anything every winter. That's why they're very busy with the flu shot. And that's why those signs are there, frankly. The question only is, how effective are they? But now that people are getting used to the concept, the average guy on the street almost never wore a mask until COVID-19. Right. How, if you're not in a healthcare facility and you're generally healthy, you hang around healthy people, wearing a mask is like, I'm not a doctor. And many people have a hesitation to wear it because it's uncomfortable. It's weird. If you go into a doctor's office pre-COVID and you sneeze and they give you a mask, like, I don't need that. What's something wrong with me? Right. But now that has changed.
Right.
Maybe it's not perfect. People realize, like you said, a mask is good. Masks actually, they help, they save lives. And, people still don't love wearing them.
Sure.
However, people that is something that's changing, and people will be more open to following the PPE rules. Again, there were isolation rooms in nursing homes, assisted livings, where you have someone in there who has an infectious disease, where you're supposed to always be going in, gowning up every time. Does it always happen? The staff hopefully do it correctly, and they know where to throw out the stuff once they're done. But does it happen when visitors come in? Not all the time, let's be honest, right?
Yeah.
But this is, like you said, I love what you said. This is the silver lining, is that people are okay taking it seriously. There's almost, I'm thinking out loud now, but I think this might be true. There's almost like a psychological thing of this. If you take precautions, it means that the problem is real. So if I actually have to put on a mask, then what am I doing here? If I actually have a cold and I can't come in here, does that mean I have something inside of me that can kill people? The answer is, yeah, it does, right? The answer is that it's definitely true. The answer is, I'm just looking at some of the comments coming in. But it definitely does. But at the same time, there are things that could be done about it, right? You could gown up, and you could also not come in. You can, or if you need a visit, like we mentioned earlier, it's so crucial to have those visits. Let's figure out. Let's be creative. It doesn't have to be, sitting on the chair right next to mom's bed, right next to mom's roommates, and you might be, bringing all sorts of stuff in. So, having the fact that a screening process is real, having the fact that the option to say no is real, the concept of wearing a mask is okay, and you can have a decent time together, even when you're wearing an ugly looking gown. And whoever wants to make nice looking gowns, this might be an opportunity for you also. But right, maybe your other business, maybe Josh's will be your business on the side. Don't tell Charles, right?
Don't leave me.
Exactly, that's what I'm saying.
Yeah, that is one thing from speaking with all these different operators at different communities, is that before, like Charles mentioned, this is something that everybody has probably wanted to do for a while. And now families and friends, like you said, didn't want to do it. And then the residents didn't feel like they needed to make people do it because this is their homes. But people are starting to realize that even when coming into somebody's home, you still need to take precaution. These people are at risk, and you hear that word on the news all the time, at risk. And you're right. People can be coming in with different illnesses that can affect at-risk people that might not affect them as much beyond COVID. And so this is really helping with people realizing how important it is to take that little extra step. Just a little extra step. You're not asking for too much here. A little extra step can go a long ways. And I think people around the world, when they're going to different, whether it's an assisted or a skilled or any part of senior living, even to their an older person's house, they're going to take those precautions now. And I think it's going to really help with the, like Charles mentioned, making senior living and skilled nursing facilities a lot safer place for people to be in, because they're going to be taking these extra 30-second to 45-second precautions that really don't take a lot of time or effort.
No, that is so true. Especially what you said, that this extends beyond the senior care space. This extends beyond nursing homes and assisted livings, right? This is true for everybody. If you're going to go to, anybody who's at risk, and you show up there in a mask, people are not going to laugh at you. When I say, "What are you doing?" Like, "Hey, calm down. This is just a news story." People are going to be understandable. If you're not going to visit somebody, I got my parents onto Zoom. They're young at heart, but they're not young when it comes to technology. I love them dearly. They're never listening to this, but that was a big deal. The isolation was a big deal for them, right? The isolation was a very big deal, and having that connection was great. But they're used to tons of in-person visits, and that happens all the time. I'm from a large family, and there's a lot of children live locally, and grandchildren, even great-grandchildren, and it's a big deal if no one can come. And now finally, now they kind of in phase 3 themselves. But the point is, this concept extends. If you want, you can even look at your work as a mission, and it's not just what you're doing, but it's what the skilled facilities, the assisted living facilities are doing, extends beyond just making sure that diseases don't enter the facility. It's a general understanding and awareness that we're bringing to the greater society, that it's okay to confront some of these challenges head on. It's okay to take steps to measure things, to put on protective equipment, and to adjust our plans. We're in denial mode a lot of times, right? That, like we were saying earlier, I don't need a mask. I don't need a check. It doesn't matter if I have a temperature. I always have, if I have 101, I can work for a week straight with 101. Eventually it just goes away. Well, that's great. And that's you. And that's because you're young and healthy. And hopefully you're right. And there's nothing else underlying. And the goal is not to scare people, but don't come into a nursing home that way, because you might be a carrier of something that's going to kill people. Right. Or it can get them, serious infections. So I think that by carefully screening visitors as they come in, we're actually, the people who leave are like, wait, I went into a nursing home today. I've been going there for years, and now they're actually taking my temperature. Now they're actually asking serious questions. Now it's not just you walk by and you end up in a resident's room. Who are you here for? Who are you visiting? Why are you visiting them? Obviously, there's a customer service piece there as well. But I do think, Josh, to your point, that this is bring a greater awareness. It used to be you go to a hospital, you go to the ICU. So then you understand that you can't bring certain things in. Like, this is a danger zone. You come in there, you do your thing, and you leave. but a place that we kind of hang out. Those are supposed to be safe spaces where we could just be us. And now we're saying that that's not necessarily always the case. Again, there'll be different phases, and hopefully there'll be a point where it may be more okay. Or if you pass the screening process, you go into an airplane, right? As unfortunately events have occurred, security has changed dramatically. Pre 9/11, post 9/11, each unfortunate event. So now they check your shoes and they check your belt. Are you upset that they're doing it? If they steal my deodorant, I'm upset, but otherwise I'm okay, right? The main thing is I'm on the plane. I'm not looking around to see who's the guy with the gun in his pocket. I'm not looking to see who's the guy with the bomb, because I'm trusting the system. I'm doing my best, and when I'm there, I know that they're doing this to me, and hopefully they can do this to anybody else, and hopefully they find stuff. So I think that this is like a mind shift, that's going. It's almost like a movement that, in general, there's initially, like, a lot of people are just like, COVID is the news. It's China. It's somewhere else. It's the other countries. It's the west part of the country. It was getting too close to you, Josh. It was getting closer to Texas, right? But when it was in California, in Washington. But over here in New York, we're like, who cares about Washington? We're in New York. We're not vulnerable. But I think the concept over here is that, no, let's confront these things. You don't die by confronting them, and unfortunately, you may if you don't. So let's confront them in the right way, and let's screen people when they're coming in. It doesn't mean you can't visit. It doesn't mean Dunkin' Donuts has to go out of business. Hopefully, okay. I'm sorry. I'll get off my little rant there for a minute. But it's getting me excited here, because I really think that this is a mind shift for people. And instead of fighting it and saying, no, I'm not going to wear it. And, you're in a public space where it's questionable if you need to wear a mask. So if you make your own decision not to, good for you, if that's okay. But don't look down at the guy who's doing it, right? Because you don't know what's going. First of all, you don't know who that person is. You don't know their own health risks. And they're taking a level of precautions that you're not. Good for them. Hopefully you're in a place that it's okay for you to do that as well. All right, I'll shut up now. But you just got me thinking there. Go ahead, Charles.
I'm right there with you. And, if you rewind, 10 months from today, and you were to try and explain to a visitor why they need to wear a mask, or why they need to put hand sanitizer on, and why we need to know where they're going, you're going to get a lot of pushback. Right? Because while we live in the freest country, sometimes freedom can be tough on small businesses and facilities, especially healthcare facilities. And so now, as an operator at heart, if a visitor, a family member, or friend comes in and they don't understand that a mask and a gown or gloves or a temperature screening, it's unacceptable. It's unacceptable at this point in time to push back on that. And that, to me, is why I am a believer that facilities and communities can be a safer environment than it ever has been. And that is my message as an operator with my staff and my 2 assisted living communities is, hey, here's our opportunity to make it better. And people get it now. And so when I say that, I believe that. And so, with our technology as well, we're able to augment that care with automation, temperatures, COVID-19 screening questions. Those are the kind of things that are very acceptable now. I mean, just the other day, I went into the grocery store and they checked my temperature. I just dropped off my car to get some work done on it. They checked my temperature. That's acceptable. And you know what? In society, at least on the skilled nursing and the assisted living side, it's a good thing. And I believe it's here to stay, and I hope it is. So,
wow.
It should have been that way a while ago. We just were never able to do it.
Right. I mean, truth be told, even with screening questions, you can't lie on a temperature scan, obviously. But screening questions, it's not a perfect system. It never will be, because you're dealing with human beings that we're not perfect beings. But I think it's a mindset shift. You're coming into a nursing home, just like if there's a guy, I'm going to take my airplane example again. But if you have a guy who's on the potential risk of someone coming on an airplane, it's very clear. You look up in the sky and you see a passenger airline explode in midair, which, God forbid, we should never see that. You understand that that's a problem, right? There's going to be 500 people there who probably will no longer live. So if we can understand that bringing in a infectious disease, being a carrier of such a thing, even if you're healthy, and
Right.
you don't have symptoms enough that are going to keep you home, but that's because you're you, but you're carrying that with you. And if you drop that bomb off in a nursing home and walk out and continue on your merry day, you're going to leave a bomb behind you in the nursing home. That's a very serious thing. Now, it may not explode immediately. It may
Right.
never be tracked back to you. You may never know that it was you. You may get away with it, so to speak. And you probably had no evil intention to begin with. You're probably there for good reasons. Most people go to nursing homes to visit, are going there either to provide care, right, to spend time with a loved one, to provide a service or something like that, right? Usually the people who are going there are there for good reasons. But by being careless on other people's expense, it'll have a dramatic negative impact. And and then that can be a very serious problem. So
just to say one thing about the COVID questionnaires, we've done a deep dive into the answering of questions. And while you're right, people can certainly not tell the truth. I think there are a lot of people out there that forget that they have been in large crowds, that forget that they have taken fever reducing medication 8 hours ago, right? And so those are the kind of questions that, oh my gosh, you know what? I went to the zoo and I was around a lot of people. While it was outside, I was still there. You know what? That gives me the opportunity as an operator to say, you know what? With that said, I know you're not going to like to hear this, but that's an issue. And it's not just about the patient or resident you're here to see, it's about everybody else. And so with that, I would ask you to wait 2 weeks and come back when you haven't been around anyone else, because this is the most vulnerable population on the planet. And you know what? People forget about that stuff, right? If one of the questions in my community is, have you taken any fever reducing medication in the last 8 hours? If they say yes, my next question is why, right? Are you not feeling well? Do you have back pain? And let me take your temperature, okay? And then maybe even I want to understand your pulse oximetry reading, which is also a big part of it. Now, there's people that are asymptomatic, get it. But to have those advanced conversations with people is a helpful thing. And while I know a lot of times we think of it as just a piece of paper, it really can help. It can, not always, but certainly by the way you structure and you ask, you start to get people to think, right? So guess what?
Great point, Charles.
The next time, right, they know that they're going to go see mom or dad or brother or sister in a facility, and there's an opportunity to go to the zoo, they might not do it because they're good people and they want to tell the truth. I believe that. So anyway, I just wanted to put that out there about the COVID-19 questionnaires. We have had millions of questions answered on our kiosk. And I looked back and about 10,000 people had answered yes to questions about COVID-19. So it's a real thing and it can help. It's not the silver bullet, but certainly I think part of the process and the part of the process that's probably here to stay.
Wow. I mean, and part of your point is that the questionnaire itself it's an educational tool, because by asking these questions, you're without forcing them to sit down to an in-service, which they'll never do, without putting it in an email newsletter, which they'll never read. This is very practical. Adults, we learn by doing. So you're in the nursing home, right? And you're coming in, you want to get in, so to speak. And you're right. The overwhelming majority of people who are coming in are good people who want to do the right thing all the time. And they're going to say, oh, you trigger their memory. You're educating them on what's important. And for right now, they might say, oh my goodness, even though I drove in an hour and I canceled work for today and all this, and they may be very upset, but they'll may be more understanding. And if not, then the operator's job is to help them understand, if you know what I mean. But more importantly is that next time, like you said, when they're out and about in the community, they're going to say, 1 second, where am I going? If this is important to me and if visiting mom is so critical, don't say, even though I was exposed, I must go see mom for her sanity. Say, let me be careful about what I do with myself. Let me make sure I stay healthy. Let me make sure I'm not exposed. Let me make sure I can honestly answer no to all those questions, so that we can go in and have healthy, safe visitation without putting anybody at risk. I just see now, I'm thoroughly enjoying this conversation. I hope everyone who's listening is as well. And I just seeing some of the comments here, some of the things we will not be able to get to right now about video conferencing and things like that. But let's just try to wrap this up a little bit, discussing a little bit about the specifics of the technology. So having a check-in system obviously is critical, and much more effective and much more practical, frankly, than having somebody there asking these questions and forming a line and doing things like that. What is unique about what your system does? And I'm also actually more curious to know, like, where are these questions coming from? Are these Accushield's questions? Are these coming from operators? What's unique about you is that you're both. So you are qualified to do both. But I'm just curious to know, how is the screening system set up to begin with?
Sure. I'll take part of this, and then I'll pass part of it to Josh in regards to the screening questions. So the process that my family used for 20, 25, 30 years was someone would walk in to the facility, they would sign a paper sign-in book, they would put the time they signed in, the resident they're there to see, and they would go on their way. And that's the way it's been for a very long time. And, 7 years ago, we said, you know what? I think operators really need to know who people are that come into the building and where they're going, what patient, what resident they're there to see. Are they with a home health agency? Are they a family friend? Are they a volunteer? Do we have a picture of that person? And so those were all the things that we did. And so now what makes us different is, one, we take that paper model for the most part, and we've packaged it up into really a touchscreen tablet-based system that will sign someone in, that will ask COVID-19 questions, and I'll let Josh address the COVID-19 questions, and also take a temperature instantaneously, and then print that visitor or staff member or even resident that signs in and out a little badge that says, I've been screened today. And so, Josh, why don't you address the question of are you able to customize the COVID-19 questions? Where do they come from, and how do you add those to the kiosk?
Yeah, absolutely. So the questions that are offered, the screening questions, are customizable for the reasons that we spoke about at the beginning. Is each state's different. Regulations change. Communities want to ask different things based on what's going on in their area. So not only the key with the screening questions is to hit them from every angle, to make sure, like Charles mentioned, and we all know, a lot of people with COVID are asymptomatic. So those screening questions, making sure you ask those questions. We will, when we speak to somebody on a call, when we're selling, we recommend some questions. We talk to them about which questions might make the most sense for them. When they're installing the system. They're gonna speak with our team during the installation process about what makes most sense for them. And then from that angle, what really makes us different is that when someone signs into our system, they have to be there to see somebody, and that goes back to really where safety and security has always been our mission. We've been a safety and security senior living company for the past 7 years. And it's always been from knowing who's in your community up until COVID. So now, not only do you need to know who's in your community, you need to know that they've been properly screened. And you need to know who they're there to see. Because if someone did come in with a high temperature, someone does come in with COVID, you need to be able to know who they were in contact with in the community. So there's a lot of things that come in to a 30 to 45 second sign-in process that makes a world of a difference. There's so many different ways you can use that information to make your community better and a lot safer. A lot safer, not just from a COVID perspective, but you need to know who's in your community. Not just let somebody walk by and come in. So that's a little change the subject from the screener question.
Yeah, and to round that out, I'm a believer that each sector, each type of visitor, or each staff member, right? A staff member comes in, they're probably going to answer different questions than a volunteer potentially, right? Because they're answering the same questions every day when they sign in. And so that's the game I play with the residents in our community is I'll change those questions up, right? So it's not the same every time. right? So they can't just hit no, 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 right? They have to really read some of those questions. You can change those around. And as an operator, if you're running a skilled facility, you can log into your dashboard and you can change those questions within a few clicks. And it's very simple to do as far as changing those questions go. Taking a temperature as well, right? That's a big part of it. To create your threshold, right? So when they sign in on that tablet and that temperature is taken, at what stage do you want to be alerted, right? So if you're the administrator of a facility and you want to know if someone answers yes to a COVID-19 question or has a temperature over, let's say 100, if someone signs in, whether it's a staff member or a contractor, you can be alerted via text and email, letting you know that someone just signed in, that tested a temperature above the threshold that you said or answered the COVID-19 questions incorrectly. And so and then it'll prompt them on the kiosk to please step aside and wait for someone.
Yeah, put your hands out, bring out the wand.
Yeah.
You got to
drop a hazmat suit from the ceiling.
Yeah, that's
exactly.
Right.
But one thing actually, what you guys were mentioning that just got me thinking also is that this is much bigger than just COVID, is much bigger than just infection control, which each one of those are way more than sufficient.
Yep.
But knowing where your people are without having to be bound to the book, to the physical book, is so critical in emergency situations. There's a fire in the building. So we got all our residents are accounted for. What about the visitors? Who are the visitors? Who are they visiting? Now that now a certain resident is missing, well, that resident has a visitor. Did the visitor take the resident out? There's just so much information from a security standpoint, from a drug diversion standpoint, right? We know that every single time when this visitor is here, that resident receives a certain PRN med, without getting too technical here, right? So what does that say? We're not missing anything, but it's suggestive of something, and that's something for us to look into. The certain staff member is in the building and shouldn't be in the building. The hospice company says that they send over their aides are going to be there 3 times a week. Well, let's look at the check-in system. They're only there 2 times a week, or they're there 4 times a week. Why? What are they doing in my building if they shouldn't be there? They're providing extra care, or is there some other stuff going on? Again, I'm just from putting on my administrator hat. I don't always assume people are there for good reasons, because sometimes they're not. Sometimes someone is on a restraining order and is not allowed to be within X number of feet of a certain another person, and it's not limited to residents. Like we're talking about staff.
Sure.
It could be the administrator's wife. I have no idea. It could be anybody. You have to assume anything. So nothing is said. But if you set these alerts up, instead of the administrator, I'm now again from the administrative standpoint, instead of hearing a message on the 3rd floor in Jennifer's room, the ex-boyfriend is there and they're yelling and there's a restraining order out on them. It's no, this person just checked in. You get alert on your phone like, oh my gosh, let's do something. So there's so much more benefit in having a good system of knowing who's in the building. Any system that you use, obviously your system does exactly what you said, but the concept is really so critical. I just see that we've really blown through the end time here, and you've really both provided so much value to our listeners about the screening process in general, and specifically how it works within the senior care settings. If our viewers and who are watching live and listening live want to learn more, and if the podcast listeners want to learn more about your company, where's the best place for us to send them?
Sure. I think the best place to go is our website. We have a very detailed website about what we do and how we do it and why we do it. And there is a place on there that says contact us, where you can basically schedule a demo with us. Get on about it.
Josh will reach back out to you.
So
my calendar link's on the website, so it's
Josh King.
My cell phone might be on there too somewhere. So
you see how Josh turns alive when you start talking about sales. Not that he wasn't. Like book that appointment, baby. Anyway, but so head on to Accushield.com. You could, if you're interested in learning more, you can hit the contact us button to learn more about, to see this episode. This episode will be live at the nursinghomePodcast.com. while there, you can look at the other episodes that we've had, and is continuing to grow. This week actually is a big podcast recording week. I think we have 4 coming this week. We're not going to dump them all on you at the same time, but you'll be able to see all the other podcasts there as well. So again, that's the nursinghometpodcast.com. And to learn more about what Charles and Josh is doing at Accushield, head on to Accushield.com. For all those who tuned in today on LinkedIn or Facebook, or those who are listening at the Nursing Home Podcast, thank you so much for joining us. We really appreciate it. Charles and Josh, thank you so much for coming and sharing with us this information. It has been really, really beneficial and frankly enjoyable. It's great hanging out with you guys.
Yeah, and we will offer a 10% discount. Just reference the Nursing Home Podcast when you give us a call, and we'd love to work with you.
Awesome. So for those who didn't hear this, if you didn't listen to them, we'll put that in the show notes. Charles is generously offering a 10% discount if you mention the Nursing Home Podcast, of which 5%. No, I'm joking.
All of that is coming from Josh's commission. I'm just putting it out. I'm just kidding.
All right. So guys, let's hit them up. You get that 10% promo. Just mention the Nursing Home Podcast when you're reaching out to the team. So thank you guys for listening. And as always, we'll be back at you with the next episode at the nursinghometpodcast.com.
All right.